All right, time now to visit with Dr. Kevin Kavanagh. He is a retired physician and also founder and president of a national organization called Health Watch USA. Hey, good morning, Dr. K.
Good morning, Jack.
We had a story a few minutes ago. I saved it here because I wanted to ask you. I know early on you were, really doing everything that the CDC recommended, washing your vegetables and all that jazz. And they say that a lot of this stuff we don't do like we used to. For example, sanitizing your groceries and sanitizing packages or mail and carrying hand sanitizer all the time and immediately washing fruits and vegetables and all that stuff. Do you still do all that?
Well, some of it, of course. I do carry hand sanitizer, but I kind of carried a small bottle of hand sanitizer prior to the pandemic. It's not bad to do. And certainly one needs to wash your vegetables. As I said, even before this pandemic, we were worried about E. coli. A lot of the advisements we were given, Jack, should be done anyways. It's just good hygiene. So yes, you should be carefully washing your fruit and vegetables. You should carry hand sanitizer. So if you do have to wash your hands before you eat or before you go someplace where you may be interacting with an area or people that aren't as hygienic. For example, sometimes my grandkids fall into that category. It would be good to have that.
Yeah. Well, there's a few things that we need to talk about this morning. I guess we've talked probably a lot about these new CDC guidelines for newly vaccinated individuals. Is there anything in that that's new?
Well, yes. I mean, I'm kind of excited. One is if you're vaccinated and you're a grandparent, you can see your grandchildren without wearing a mask. And this is even if your grandchildren aren't vaccinated, which of course they won't be because the vaccine's not approved for children yet. You also can gather with others without a mask if it's a small group, for example, one household, and you can gather with others, of course, who are vaccinated. The one thing which hasn't lifted that does have some discussion is that they're still discouraging travel from one area of the nation to another. And of course, people are saying, well, if you can gather with other people without masks or can gather in small groups like a single household with other individuals, why can't you travel? And I believe the answer to that is they're scared of spreading variants from one area of the nation to the other, because there is some concern that even though you're vaccinated, you may spread the virus. But the good news on that is that multiple studies now are starting to come in. Now, these are preliminary studies, but they're starting to come in that if you're vaccinated, it cuts down on asymptomatic spread. For example, there's a study out of Israel that looked at over 7,000 hospital staff, and they found that there was a reduction in asymptomatic cases once these staff were vaccinated, and this reduction was by 75%, which is a huge reduction. There's also animal studies which have supported this. So I think these guidances will be further relaxed even as we get into the next couple of weeks because of data. And I should also add that the results of the labs and also some of individual and population studies looking at the vaccines against these variants appear to be very good. For example, Pfizer-BioNTech vaccine, and this was a laboratory study, but they found very good suppression of not only the United Kingdom variant, but also the Brazilian variant, and some decrease in efficacy, but still what they discussed as robust activity against the South African variant. So if these laboratory studies hold up and some of the population observations, I think we may be headed for a very good summer where we have significant relaxation of these restrictions. Of course, this is all predicated on that people go out and get vaccinated. We are literally at the end of this thing, providing people continue to follow public health advice, and let's get out and get vaccinated.
Back to travel, something that concerns me, and especially with Florida being so lax now, are all these kids traveling to Florida on spring break from all over the country and then going home with something. That could be catastrophic.
Well, yes, that is of concern because not everybody has had 2 doses of the vaccine, Florida has variants of this virus, and they could be spreading the virus because the majority of those individuals have not been vaccinated because they are younger. Remember, everything I said, all that good news is predicated on vaccinations. And if you're not vaccinated, you really do need to continue to follow public health advice because these variants are more infectious. So even though we have a population that is starting to become vaccinated, that percentage is still very low compared to the increase in infectivity we're seeing in these variants. So again, we're almost at the end of this thing. Let's hold course. Let's not do things crazy like travel or do things crazy like go out to a bar without a mask, have a big party, etc. We just need to hold on for a couple more weeks.
Dr. Kevin Kavanagh, thank you, sir.
Thank you, Jack.